Hi, my name is Melanie Jacob, and I'm here today with Eileen Pierro, and we are going to talk a little bit about our 3 top takeaways from our conference that we attended in Boston. The MEDA conference. MEDA is Multi-Service Eating Disorder Association. And Eileen, tell us first a little bit about yourself, and we'll get started with our takeaways.
Well, thanks, Melanie, for having me. This is great. I'm so excited to be with you after so many years. Anyways, I'm Eileen Pierro. I'm a registered dietitian. I'm currently working with my own private practice and also with Centers for Eating Disorder Management in New Hampshire. And it's been a wonderful experience to work with all these patients. And my previous work was primarily with children and adolescents and general community healthcare.
Right. Eileen became very persistent, maybe back in 2019 to say, please mentor me, teach me, show me stuff on eating disorders. So we were able to do have a couple clients together and use more of a family-based treatment model and help some people, and it springboarded you, Eileen, into this field, which I'm super happy about. I myself have been on a sabbatical since 2015 when I moved to China with my family. I had to close my private practice up, which I exclusively saw and treated adolescents with eating disorders and coached families. So when I moved to China, I sort of pivoted to more coaching, dietitian, but being 13 hours difference of the time, it really quickly ended. And outside of a couple conferences and trainings and speaking events, I really haven't done a lot of client work. So this conference for me, I'll start, was almost like catching up in the field and on things that I have been completely out of touch with or things that have changed. And I especially love Wendy Oliver Pratt's final message at the end that talked about what has changed. And she was like, and I've been doing this since the 90s. So what has changed in this much time is a lot. So one of the key takeaways is the role of trauma and eating disorder treatment. And, one of the talks was on the great equalizer of COVID and how that was so traumatizing for so many patients. And whether it meant creating food insecurity or creating less access to care, less access for underprivileged people, or just lack of access to treatment, it really impacted a lot of eating disorder care. And so the new approach is to treat trauma at the same track as you're treating eating disorder. And the previous kind of mentality, or the way I was trained, is you treat the most life-threatening thing first. So if you have a pulse of 42 and you have anorexia, you treat that first. If you're cutting, you treat that first. It's like, but what they described in a treatment setting is that really doing a dual track. So that was really new for me, and a very great presentations I heard on trauma and post-traumatic stress.
And also treating all the other comorbidities that they may have.
Right.
Yeah.
Not just treating eating disorders, but looking at the person as a whole. And,
absolutely.
I think,
and I'm seeing that in my line of work right now. We have some clients that have significant trauma history, and nutrition becomes the priority when they're nutritional status is really affected by their eating disorder. So they kind of, like the therapist as well as the medical providers, you really push for the patient to follow the recommendations of the dietitian and work with their feeding issues.
Okay, especially it sounds like it's a multidisciplinary team, which is something that's super essential in treatment. And I think that to go to my second thing, and this is really interesting because I'd like to hear your thoughts on this, Eileen. It's the first time, I had heard of the term BIPOC, which is Black, Indigenous people of color. and BIPOC. And I had never really heard that term until maybe this last 6 months. So we actually had a lot of presentations talking about the importance of clinicians being able to have training and exposure to work with a diverse group of clients, and not just ethnically diverse, but also even gender diverse. And I think that's something that I just I had very limited experience. And I sadly, here in Michigan, even after like, I want to say over 15 years of practice, I had very few clients that were not only just white clients, which this speaks to the inequality of actually the treatment, the training, and the access. So I think this is going to lead to our next talk on harm avoidance. So maybe we'll do that next week.
Yes, yes, absolutely. Yeah.
So, and then my last one is just to be more concerned about the impact of weight bias versus weight itself. And this is a whole topic, Eileen. I was always fighting kind of with the doctors not to use the BMI just as an individual number, and really looking at growth trends for your teens. And if the teens are in a higher weight body, they may have a normal higher weight growth trend, and that you can't really determine the health of someone by their weight. And
it's not only that, it's also, you know, as I understand it, some diverse groups may have a higher density, bone density. So therefore, their weight is going to be higher than your average person. And that doesn't necessarily mean that there's a medical problem.
Right.
And I think many times when you just focus on the weight, then you miss out on what actually the problem is, because everything is attributed to the weight when it might not be.
Right, right. And even different cultures have different body shapes. And, you know, I stand here today recognizing I have, like, because I'm tall and I'm white, I actually have a privilege, and I have a privilege in all the things that I do. And so it really has opened my eyes up to just even in a counseling setting, how to actually approach things with a brand new mindset. So what were your takeaways, Eileen?
So I have to say, well, the first takeaway I wrote down after our conference was listening to them say, and which is so true, we as providers are very aware of this, that the evidence-based science research is actually behind what we actually do in practice many times, because due to our constant contact with different people, we have learned through experience that well, maybe these things seem to be working for us with this certain group of population or clients. So so we may be doing things in practice that are not being proven in research. So that's one of my takeaways.
So with the wisdom of clinical experience may sometimes outweigh the evidence-based treatment.
Absolutely. It's like follow your gut.
Sooner, right?
Yes. Then the other thing was that treatment should be flexible to accommodate clients' needs and desires. And that goes with the theme of dealing with different groups, the BIPOC population, for example. And the other one is for us specifically as dietitians working with the eating disorder population, it is very important to become knowledgeable in the use of different therapeutic modalities or psychiatric therapeutic modalities. And many times we don't feel very comfortable because we are not taught that in our bachelor's degree or even maybe in our master's. I mean, it really depends on what specific area we're going into. Right. And also because we've always been taught that we need to stick to nutrition, you know, and it's like, oh, are we kind of jumping the line between being therapist and nutritionist? And really the way I look at it now is that we can use those methodologies to teach about, you know, health and nutrition within our, practice. But if we don't know those methodologies, we are not going to be able to really work with the client, because many times, and as we know, in eating disorders, food is not the problem, it's something else.
Right.
But food is kind of like a symptom of, or a way they're coping with whatever the real issues are.
Right. I think this is a very essential thing, and especially anyone new in going into eating disorder, desiring to treat eating disorders as a dietitian, should take courses on DBT, CBT, ACT. These are like all of these modalities that therapists use that we need to speak the language, at least be in the room together as we work with patients using these concepts. And it's not like we're doing this, but we may be applying it or validating it in session. So absolutely. And then of course, FBT. So I would say these are really great takeaways, Eileen. And, I just had a great time. It was just like I was brought current into and so I have pages of notes, pages and pages of information. So I'm looking forward to, over the next 10 to 12 weeks, for us to put out little sessions on what we've learned, how we're applying it, what our questions are, and where we go from here.
Yes, I'm looking forward to that too.
Any final thoughts?
Well, it's just a pleasure to reconnect with you and to be doing this with you. And I had a wonderful time at the conference, sort of getting up to date with certain things that we were not, and sharing our own personal relationship.
Right. Making those memories. Okay.
Yes,
so
absolutely.
Until next time, this is Eileen Pierro and Melanie Jacob, dietitians at Eating Disorder Care. Thanks.